If you're having pain in your sacrum or think you have an SI joint pain, then this video is for you, so stick around. Hey, how's it going guys? It's Saman here from All Things PT, and in this video I'm going to go over SI joint pathology and how you can treat them with exercises. Before we get into how to treat SI joint pain with exercises, we really got to make sure that A, we know about the anatomy first, and B, you know if you actually have an SI joint pathology before we start doing those exercises. Now that I have my skeleton in place, we can go over some anatomy first. So first of all, lower back right here. This is what you call your sacrum. This is the coccyx or the tailbone. Then we have your acetabulum. Together with these two acetabulum, we form a pelvis, okay? So now, as you can see over here, your acetabulum, the iliac portion of the acetabulum connects to the sacrum. And the iliac and the sacrum together makes an SI joint. Now, SI joint is going to be a very stable joint and does not offer a whole lot of movement. There is barely any movement. Now, for whatever reason, say maybe you had a fall on one side where you landed on your butt on one side, maybe you had a jolt of some kind, maybe you had a trauma, maybe you have something like a childbirth, something big, and then chances are this might move a little bit more than what it needs to, or what it's supposed to, causing pain in the symptoms in this area first. So once we know the anatomy, now we know if you have an SI joint pain, then your pain is going to be somewhere around this area. Typically, it's going to be unilateral. So how do you really find out if the pain is actually coming from the SI joint? Well, first of all, if it quacks like a duck, it probably is a duck. So what you're going to do, you are going to, and sometimes it helps when your partner or a family member does this for you. It's just more easier, because what you're going to do, you're going to go around your back here, and you are going to find this portion is going to be the sharp portion of the acetabulum right here. And you are going to put your finger down, and you're going to go until you find like a pokey thing right around this area. And you're going to put some pressure right here. You are going to give a little bit of a pressure, downward pressure, because you'll be lying down on your stomach. Or you can even do it standing, but it's more effective. It's easier to find when you are lying down and a partner or a family member does that. And you're going to give it a really push. And so if you are having a pain over here, or you could have pain in the other parts of the spine, but the pain is most pronounced over here, chances are you have an SI joint problem. That's one way to figure out. And then you can palpate or push the other side. Maybe the other side is not as sensitive. Even if it is sensitive, you should be feeling like a clear difference. Oh wow, this really hurts, versus this one is just not comfortable type of thing. Second way to find out is looking at the front of your hip. What you're going to do again, you're going to make your fist like this, or the hands like this. You're going to put it right on top of the hip, just so that as a family member is putting your hand, it's going to be like this on the hip. And you're going to have them come forward and find this landmark right here. And it's very pronounced, especially in women, and it's going to be somewhere around this area. It's very easy to find. Okay, so you're going to have someone palpate and follow along this crest right here and find this pointy thingy. It's very pronounced on a lot of people, especially for women. And what you're going to do is you are going to look for symmetry. Now these should be level, okay? So now once you find these points on both sides, then you are going to see, is this level or it's a little off? So if we have an SI joint pathology, because your joint moved a little bit more than it should, these are going to be a little off. Maybe it's a little high, maybe it's a little low. So that's another way to find out if you have an SI joint pathology. So now, once we got that figured out, let's go and do some exercises to fix it. One thing I forgot to mention is that if you recently had childbirth, especially normal delivery, and your pain around that area started after the childbirth, then chances of it being SI joint pain is very high. Overall, women tend to have SI joint pain much more than men. Now to the fun part where we get to treat the problem. You basically need two things. First, you need like a stick, a dowel, cane, golf club, whatever. Second, you need like a resistance band, and this is actually optional. If you don't have resistance band, then you can obviously use a belt or something, and I'll show you how to do that. Before we begin, what I want to kind of make sure that you guys know is none of these should be painful. It may be difficult, that's a different story, but it shouldn't be painful. It shouldn't be causing any radiating symptoms or stuff like that, especially on this one. So the goal of the whole exercise, all the exercises, it's kind of like, first we need to make sure that your hip is level. That's number one. We need to reset the hip, and then once we do it, then we need to follow up with strengthening exercise that that will help to kind of provide stability around that pelvic area. So this is your first. I'm going to show you the first exercise with the stick, and for this, what you need to do: lie down on your back, make sure that you're in a comfortable position, have someone kind of check this ASIS that we were talking about. Okay, actually, before that, what I want you to do, if you're currently having pain, then I want you to walk around and see how that area feels. Get like a general feeler for it, and if you have pain in that area as you're walking, I want you to rate it 0 to 10, whatever that number is. That's for you. So now you're going to lie down. You're going to make sure you're comfortable and straight, just so that, you know, you're trying to make sure that the hip is not off or whatever. So lift yourself up a little bit, shake yourself off so that you're level. And you're going to lie flat. You're going to have a family member kind of check this ASIS level over here. And then you are going to figure out if it is kind of off or not. Then what you're going to do, you're going to get this dowel or a stick. You're going to put one side under, like this, and one side over. You're going to make sure your spine is not completely flat like this, nor you have like a big ass arch like this. You're going to be somewhere in the middle that's comfortable. And what you are going to do with the top leg right here, you are going to push it like this, and with the bottom leg, you are going to pull it up like that. So where you're pushing and pulling with the same amount of force, and as a result, the stick isn't moving. And you're going to hold that for 5 seconds and then relax. And then you're going to repeat that. Push, 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 push. Relax. And then you're going to repeat it. Okay? Then what I want you to do, again, reset your hip, relax, and then you're going to remeasure again to see anything happened. Okay? Maybe it did, maybe it didn't. And then you're going to walk again, just like you did, and then you are going to rate yourself the pain, and you are going to get a feeler and compare yourself. How was the walk right now versus a couple of minutes ago? Maybe it did, maybe it didn't. If it helped, great. If it did not, then you are going to switch, where now you are going to put the dowel on the opposite side. So before it was like this, right? And now it's like this. Obviously, if you're in pain, you're going to move slowly. All of these exercises, again, should be pain-free. And you are going to do the same thing, 5 sets. 5 repetition with 5-second hold. Again, the 5-second hold is very important. 5 times. And then you are going to compare it. This is the important part. You are only going to find relief with one side. Because I am not there present with you, and this video is more for educational purpose, I can't directly tell you right now which side the dowel should be. Because I have had patients where people found relief on one side sometimes and not the other side, whatever. So sometimes it's just it's a 50-50 risk that you got to take. That's why I'm telling you, don't push through the pain, okay? And so once you found out the directions that help, always only do it on that direction, and don't try to do it both ways. Remember, your hip was kind of tilted. With this exercise, we're trying to put it back. You do it from both directions, nothing is going to happen. And so every time you do this exercise, you want to make sure that your hip is level or not. If your hip was level prior to doing the exercise, skip this exercise. There is no need to put it back to place if it's already in place where it's supposed to be. Okay, so this is done only till a point where your hip was kind of off, you do this exercise, it's on, and then you do the other exercise I'm going to show you. The next day when you come in, you recheck it, the pelvis level, the ASIS level, and if it's even, skip it and just do the other exercise. Third day, check again, check again, check again, and only do it when your hip is off. So now that's out of the way. If your hip is in a flare-up right now, or if your SI joint pain is in a flare-up right now, then these are the exercises I want you to do. Okay, so flare-up, a lot of pain means your pain subjectively is 6 or higher. So if you don't have the band, like you saw, I just put the band around above my knees. And so if you don't have a band, that's okay. You can tie a rope, you can tie a belt, whatever. And you're gonna push the band like this, and you're gonna hold for 5 seconds and relax. Push, hold for 5 seconds and relax. Push, hold for 5 seconds and relax. Push, hold for 5 seconds and relax. Now, if you are using a belt or something, your range of motion obviously is going to be limited, but that's okay. So, what I forgot to mention is, so I'm doing like 2 categories of exercise. So this one is going to be for glute med category. So this is the easiest version. Once you are able to do this pain-free, or I should say without increase in pain, you are going to do the second version of that, okay? For which you can take the resistance band out if you want, or you can keep it if it's easy. It should be challenging but not painful again. And you are going to get this knee to about 90 degrees, give or take. And what you're going to do, you are just going to use the side butt muscle to lift it up. Hold for 5 seconds and relax. Hold for 5 seconds and relax. Just like that, okay? I'm going to change the angle just for the video purposes. Hold for 5 seconds and relax. You should be feeling at right this portion of your hip. So I'm going to show you from behind, about a 90 degrees or so. Bend, use this part of the butt muscle, hold for 5 seconds and relax. You are going to do this about 10 to 12 repetitions. Now, mind you, the key is holding for 5 seconds every rep. Once you are able to do that, then you are going to go to the side, where instead of your both knees bent, only one knee is going to bend, and then you're going to lift your hip up like this. Okay, keeping your knee straight. What we don't want to see, what 90% of people will do, is bring the hip forward and do this kind of thing. You are just working your hip flexors. We want to feel the burn on the side of the hip. Just like that, okay? And once you can do this with relative comfort, then we'll move on to the standing exercise. You guys can do a single leg hip abduction, then it's time to do some standing exercise. So, like I said, a band would be helpful, but you really don't need to. What you're going to do, and you're going to do it on both sides, okay? What you're going to do, you're going to stand on one leg, you're going to hinge your hip back, just like I am. So I'm going to show you from this side. Hinge your hip. We don't want nothing like this type of thing, okay? So you're going to hinge your hip back, and you're going to try and balance, try to get that hip level, and you're just going to lift this knee like this. So now, when you do this, both of your hip actually works out, okay? So this hip right here, that's on the ground, okay, hip hinge, is working to stabilize the whole body, and then this hip is actually moving. And once you can do this comfortably, you tie the band. Okay? And then you do the same exercise. Hip hinge, maintain your balance, and do that. Okay? This is not something that you necessarily need to hold, but if you want to really challenge yourself, you could. 1, 2, 3, 4, 5. Relax. 1, 2, 3, 4, 5. Relax. And it's okay if you touch with your tippy toes for balance or in between repetitions. Again, go. 1, 2, 3, 4, 5. And even in 3 reps, I can really feel my glute med firing. So let's just do it on this side as well. And it's normal for one side to be a little bit weaker than the other. If for whatever reason your hip abduction or your side lying hip abduction was easy, but then this tends to be super hard, or you don't want to do it because you have balance limitations, whatever, then you can still put the band around and you can do this side stepping just like this, and this will also work on hip abduction. Okay, so now all of this again, you're going to shoot for 10 to 12 repetition. You're going to do about 2 to 3 sets. So that was the glute med progression where I gave you 4 exercises. You don't do all of them in one day. You just progress from one exercise to other than other. There are 4 of them. So now we're going to go to the glute max portion. And so when you have a flare up, maybe all you can do is butt squeezes. Okay, you're just squeezing your butt, holding for 5 seconds and relax. Squeezing your butt, holding for 5 seconds, and then relax. Try experimenting with your leg position. Maybe knees bent is easier, and squeezing your butt and relax, or somewhere in the middle. Okay. For me, I really only feel the butt squeeze when my legs are straight. 5 seconds and relax. So once you can do that comfortably, it's time to move onto a bridge. So both knees bent. Squeeze your butt, lift your body, hold for 5 seconds, and relax. Again, we're going to lift our butt, squeeze, and relax. You should be feeling on the back side of the butt, okay? Not on your lower back. Because a lot of people will arch their back like this, and their back is gonna hurt because they're arching their back, but they don't feel anything on the butt. This is a butt exercise, so squeeze, hold, relax. 5 seconds. Without pain, you're going to progress by doing a single leg bridge. Okay, so one leg down, squeeze your butt, hold, relax. We're kind of actively monitoring that our hip doesn't fall like this. Obviously, this is an exaggeration, but you know, guys, know what I'm trying to say. You're just going to hold, squeeze the butt. You should be really feeling, and then relax. And repeat that on the other side. Squeeze the butt, make sure your hip is level, and relax. You gotta understand that these progression may take weeks to progress, and that's perfectly fine, okay? And after that, you're going to do the last version of the standing exercise. Now, the final exercise for the glute max version is going to be your squats. And so all you want to do is you want to go and do a full squats like this. Try to keep an upright posture as you do that. If you say don't have enough mobility, there are still a couple of things you can do. You can limit the range of motion that you go. Okay, let's show you from this angle. You can either limit the motion that you can go, or you can hold on to like a kitchen table, or I should say kitchen counter or something, and then you can work on going up like this. For a lot of people, when you have some kind of support like this, it tends to make their life a little easier, the exercise a little easier. What we don't want is we don't want the back to arch like this. So chest high, and we also don't want none of this where the knee is actually going forward. Okay, we just want our butt to drop and squeeze on the way up. Squeeze on the way up. Okay, again, it's a glute max exercise. You gotta squeeze your butt on the way up. Once that gets easy, you introduce this band again. You're gonna put it above the knee. And then you can do the same version where you can either keep it chest high, put the band up, press the band out, and keep it there. Squeeze the butt on the way up. Okay? Or you can do the same thing like this. Okay? I give you guys 3 exercises. The stick one that you only do as needed. Then I gave you the glute med version where I gave you 4 progressions. And then I gave you the glute max exercise 4 progression. Again, don't do all of them at once. It may take a couple of weeks before you can progress. That's fine. Most important, none of these exercises should hurt and should increase the pain. It's normal for the hip to be a little sore, like a muscle soreness after you work out, but it shouldn't be a sharp shooting pain. There should be no new pain because of these exercises, no shooting pain, nothing like that. Hopefully this video helped. If it did, please make sure you click the like button. Please subscribe to my channel because more videos on physical therapy coming soon. Until then, take care. Bye-bye.